Broadcast is now starting. All attendees are in listen-only mode.
Greetings, everyone. My name is Krista Brown, and I'm the training specialist with the APS Technical Assistance Resource Center, the APS TARC, and I want to welcome you to our webinar, Innovative Responses to Self-Neglect, with Joyce Reed, Traci Robertson, and Stephanie Woodard. And I'll be formally introducing our presenters in just a moment. Next slide, please. Before we get started, I would like to share a little bit of information. This webinar is being hosted by the APS TARC, which is a project of the U.S. Administration for Community Living, Administration on Aging, and Department of Health and Human Services, and is administered by WRMA Incorporated. Contractors' findings, conclusions, and points of view do not necessarily represent the official policy of the federal government. Next slide. As many of you know, the APS TARC works with states to enhance the effectiveness of APS programs. And we do this by working with partners on the use of data and analytics, applying research and evaluation to practice, and encouraging the use of innovative practices and strategies. Essentially, we're here for APS programs, so please reach out using the contact information that is going to be displayed at the end of the webinar. And next slide. You may not know that the APS TARC presents monthly peer-to-peer calls, and these calls provide a forum for workers, supervisors, managers, and administrators to dialogue and share ideas with each other about the issues and concerns facing APS programs today. Depending on which peer group you identify with, you will see they are held on the second, third, or fourth Wednesday of each month. And if the registration is sent out via the APS listserv, if you are not a listserv member and would like to receive the registration, please go ahead and contact us and we will get you signed up. Now on to some housekeeping. The slides are available for you on the slide panel of your GoToWebinar platform. You can download those at any time. Please use your computer speakers to access audio for this webinar. And if you experience any broadband or audio problems, we recommend that you go ahead and log out, close down, and then re-enter, log back into the webinar. Next slide. This webinar is also being recorded, so we will, if you are not able to join with us, we apologize for that, but you will receive a link to the recording as soon as it is posted to the APS TARC website. We'll make an announcement to all folks who registered and beyond. You may ask questions of our presenters at any time by typing into the questions box. We're going to try to get to as many questions as possible. We do have a full presentation today, so feel free to, as they come up for you, any questions or comments, just go ahead and send them through the questions box. Last but not least, all attendees will receive a automatically generated email in about 24 hours with a link to download your certificate of attendance. And when prompted at the end of the webinar, please go ahead and complete our very brief survey. We love to hear from you. So before we get started, next slide, let's go ahead and poll who we have with us today. We have lots of folks. So I'm going to launch that poll. And which of the following categories do you identify with the most? So are you APS professional, another social services professional, medical, legal, or other? And for folks who are other, go ahead and pop that into the questions box. We're always curious. So we'll give that a couple seconds. All right. I always like to give us at least maybe 75% of the folks voting. So we are almost there. All right. Gonna close it now. And close that poll. And I'm gonna share those results. All righty, so majority of folks are APS professionals. Welcome. We've got a few other social service professionals, a little bit of medical, a little bit of legal, and some others. Great, thanks. So we see staff at Advancing States. Welcome, and welcome to everybody. Next slide. I'm going to go ahead and hide that. Okay, my great pleasure to let's get on to business and introduce our presenters today. We have Joyce Reed, who is Field Operations Director, APS and Child Care and Community Services with the Tennessee Department of Human Services. We have Traci Robertson. She is the APS Complex Case Investigator and Self-Neglect Subject Matter Expert, also the Guardian Conservator Contract Administrator with the Oregon Department of Human Services, Aging and People with Disabilities, Adult Protective Services Central Office APS Unit. And we have Stephanie Woodard, Program Manager, Adult Protective Services and CAPS Check Unit, Adult Mistreatment Prevention and Response Section with the Colorado Office of Adult Aging and Disability Services. So we will hear first from Stephanie, and then she'll turn it over to Traci, and then we'll hear from Joyce, and then I'll be back to take some questions. So Stephanie, go ahead and take it away.
All right, hopefully that camera and audio is working, and I hope people will chat if it's not. Good morning, everybody. Like Krista said, I am Stephanie Woodard. I am the manager for APS in Colorado. I'm excited to share with you all a little bit about a pilot program that we are working on. But first, I wanted to just preface this with a couple of points. This pilot is not necessarily specific to self-neglect, but it does include all self-neglect allegations for those who are participating in the pilot. And so I just want to point this out to clarify that some of what I say today may, I may be talking about other mistreatment allegation types, and that's because the pilot is a little bit broader than just self-neglect. And secondly, this pilot doesn't launch until January. So as I'm speaking today, it's from deep in the trenches of development, and in partnering with the TARC for this webinar, we felt that being able to speak to what the pilot is and some of how we got here and what the process has been to launch this might be helpful to you as well. So I'll be talking about both of those things. Next slide. So the Alternative Response Pilot, or AR, as you'll hear me saying, has been a long time in the making. Colorado APS is administered on a state-county system, so APS programs administer it at the county level, and we provide oversight here at the state. I would be remiss if I didn't underscore just how much the counties really drove this from the beginning. So over 10 years ago, Child Welfare in Colorado started a differential response pilot, which has expanded since then to most of the child welfare programs, and it's continuing to expand at this point. Against that backdrop, we had several county representatives from APS programs in 2018 pulled together and started to think about how could we potentially do this in APS. And so they started to explore that, really spent a lot of time over those 3 years coming up with ideas, and their work led to the introduction of Senate Bill 21-118, which was signed into law in June of 2021. Next slide. Okay, so with the passage of that bill last year, that tasks us at CDHS with the development and implementation of the pilot. Our charge is to create an alternative option for people for low-risk reports of mistreatment or self-neglect against at-risk adults. So we are required by the bill to limit this to no more than 15 counties. There was a lot of urging in the statute to make sure that that has diverse representation. We have, different sizes of counties, different geographical locations. And so that was an important thing to do. And we also need to develop rules that ensure alternative response has two key changes. First being that initial visits are not required to be unannounced, which differs from our current practice. And then the second, that a finding is not made concerning the alleged mistreatment or self-neglect of the at-risk adult. Talk a little bit more about this a few slides from now, but those are sort of in a nutshell, the key changes of this program. Next slide. Okay. So the other requirements of the bill are that we establish an evaluation contract with an independent evaluator. Specifically, we have to make sure that they're looking at the effectiveness of the pilot, and that information will help us fulfill the other requirement, which is to report back to our General Assembly in 2025 and 2026 on outcomes, on recommendations, information from that evaluation. Based on that reporting, the General Assembly may decide to keep the pilot going, continue, repeal, things like that. Next slide. On the slide is a brief timeline of kind of what we've done to now, how we got here. So early, right after the bill was signed, we started some listening sessions before putting pen to paper, asked the community for recommendations and ideas and concerns. We then convened a preliminary development work group, which had folks from that original 3-year county work group in recognition of the fact that they had spent 3 years working on ideas, had a lot to contribute, and we did not want to see that time go to waste. So we did some preliminary work with that group for a few months, which led to the creation of the selection process, the application for pilot selection, led to sort of an outline of rule and identifying key decision points that we would need to walk through. That took us to official rule development. So in October 2021, we started with our policy task group, which is a bunch of APS subject matter experts from our counties. And all of our APS rulemaking starts with this group. We really talk about how this would impact. We really get in the weeds about what do we need to do, how do we need to write it, what are the impacts. And so from April through October, really got into the weeds with that group, developed our draft rule, and they voted in April to move it forward. Like many states, I'm sure, we have several stops along the way for official rulemaking. I won't bore you with any of that, but suffice it to say that from May through September, we have monthly meetings of multiple groups that have to approve rule. And so bringing us to present, we also held some additional stakeholder engagement sessions once we had a draft rule to make sure that we could integrate any feedback from them. That was, inviting community members and non-APS program staff to discuss anything that they had concerns with or revision suggestions. And then right now we're at sort of the final stage of rulemaking. So we will present to our State Board of Human Services in August, second read in September, and hopefully have an approved rule packet by then. Then we spend through December training, developing data system changes, finalizing all the details, and we launch in January. Next slide. So that background in mind, I'll provide a summary of major AR related changes. So first, the major concept is that we have 2 tracks. There's a traditional response track, which is what we do now. There is no differentiation now. That is the current expectation. And then the alternative response track. That is meant to be assigned to allegations that are determined to be low risk. Then the next sort of piece of that is what can and cannot go, what is low risk, right? So we have 3 general sort of parameters shaping that, that process of determining what track to be assigned. First is that all self-neglect goes to the AR track in these pilot counties. Second, there's a list of what we've called exclusions, which just means that there are characteristics or certain allegation types that we as a system don't feel make a lot of sense to go the AR route. And so they have to stay on the traditional track. And then there are sort of parameters for what's left. And if you go to the next slide, there's a visual representing what I'm explaining here. But basically on the left, you see self-neglect will always go alternative response in the pilot counties. On the far side, you have then exclusions, which will go to the traditional response, meaning if it's an excluded type of allegation, it has to be assigned to the traditional response. And what's left is neither self-neglect nor exclusions, and the counties then exercise discretion based on the specifics of the report. And so there are some rules that sort of create guardrails, and we call those considerations for the counties to use in making the determination of whether this is low risk or not. If they determine it's low risk, it would go to the alternative response track, and if not, the traditional response track. Saving us time because this is focused on self-neglect today, I won't get into the weeds on what exclusions are or what our considerations are. Happy to discuss if people end up following up with us on that later, but focusing on self-neglect, we'll just go on to the next slide. All right. So the other sort of hallmarks of this are that we are operationalizing as much flexibility and responsiveness as possible. The whole idea behind alternative response is that this is a tailored approach. And so we want to make sure that we're using it when we should and not when we shouldn't. So our track assignments are made at the level of the individual allegation. We all know that reports can come in with multiple allegations, and so it's possible that a case could be opened that has an allegation that would be tracked to traditional because maybe it has an exclusion in it, and an allegation of self-neglect, and that self-neglect would still be tracked to AR, so that we're truly individualizing the response. The other hallmark is that there are separate investigation rules. So while no official finding is made, no due process is a part of the alternative response outcome, we do still have an obligation to look into each and every allegation regardless of what track it lands on. So there's AR investigations and there's traditional investigations, and it's what we do at the end of those and that initial visit sort of differentiation that is different between the two tracks. Again, won't dive into the weeds of those separate rules, but it's enough to know that we have sort of a separate set of investigative rules for the alternative response track. Next slide. So it's our hope that this pilot will open the door to increased positive rapport with community members, partners, clients, and families. We have this vision statement here. It's part of the operational plan that many of you, I'm sure, have gone through here in the States. And we just really feel like the alternative response pilot aligns very well with that vision statement, that we've got to focus on an innovative and collaborative client-focused workforce to meet our obligations of the program. We have aimed to support client safety and allow the program room to evolve and adapt through this pilot rule. And so we're really looking forward to launching that. The next slide then has, bringing it all back to sort of the core of this webinar, I want to clarify how we define self-neglect in Colorado so you have a sense of what we're sending down that track when we say that all self-neglect goes that way. The definition is up there sort of broken apart because it's a big paragraph, but these are things that threaten, that substantially endanger, I should say, the health, safety, or welfare of a client. And there are some caveats in our rule to sort of focus on the fact that there is attention needed to self-determination. Somebody doing something that general society thinks is unusual doesn't necessarily mean it's self-neglect. And so the rule speaks to that, or the definition speaks to that. And our definition has some allowance, obviously, for things like end-of-life care and things like that that would not be considered self-neglect. Next slide. So this is just a little bit of information about self-neglect in Colorado right now, our current approach, keeping in mind that alternative response will change some of this. But this is our sort of most common allegation in Colorado. Approximately 30% of the allegations we got in fiscal year 21 were self-neglect. Unannounced initial visits are required currently. Obviously, with this, that would change. Self-neglect may be substantiated. Currently, that's an outcome that can happen. That's the finding that we would use if we feel that the definition is met. But those substantiations don't come with due process. We're not sort of accusing a person as being a perpetrator in the way that a substantiated finding happens for a mistreatment allegation, but it still sort of is there. So there's the hope that with alternative response, even sort of psychologically for the caseworker, not having to call something substantiated for self-neglect, it may not operationally change that we weren't giving them due process notification now. It still changes the approach and the feeling while you're doing the casework. Additionally, with AR, the option to schedule a visit will go a really long way in starting off the interaction on a more positive note. And so we hope that that will demonstrate results in receptiveness and increased sort of openness to the case planning process that happens in our current investigation process. And the assessment of risk and safety noted here on the slide, that's part of our process. It's not changing with alternative response. All cases, regardless of the track assignment with this pilot, will still include that, where caseworkers are identifying needs, identifying what needs may not be met, and trying to coordinate resources and supports within the community and the individual's network. Next slide. So we were asked to say, what have we learned? And we're still learning. We're right here in the middle of the process, but I would say sort of the biggest things that we're just really grateful for is the collaboration and the unique approach that we've taken. We've really worked very closely with entire program. And we are much better, and we've crafted a much better product than we probably could have ever done on our own because we've worked so closely with county staff. And one thing that I think we really learned along the way, months and months of development, every time we hit a decision point and had intense discussions, we won't call them arguments, when the best decision is not clear, it's okay to make the next decision, especially building something. Building a pilot, it's going to be a work in progress. We're all fallible and human, and we can sort of take the step forward knowing that what we're doing is coming back to our original priority. If we're prioritizing safety and this innovation at the same time, then if we have a couple of routes to go and we can't decide, but we think they're both vision aligned, we make the next decision and go forward, being open to course correction. So that is sort of what I would say. I'm sure we will learn much more, and if you ask me in a year, I'll have different things to say. But with that, the next slide is just our contact information. There's a lot more to say about this, and I hope I didn't go over time. If I did, I hope not too far over. But we have an AR pilot planning specialist, Elena Romero, and myself are the primary points of contact if you'd like additional information. We also have a section on our website specifically related to this pilot, and we try to keep that updated along the way. So I think that's my time.
Thanks, Stephanie. Yeah, no, perfect. Thank you. And just a quick clarifier: Colorado does have an APS registry, correct?
Yes,
okay.
That's we call it the CAPS. We call it CAPS checks, but yes, pre-employment background screening of the APS.
Great, thank you. All right, so Traci.
Oh, I seem to be messing with my camera a little bit just to make sure everyone's awake, I guess. Thank you very much. Let's start with that for this opportunity and the invitation for Oregon to join this group and share our innovative strategies for working with aging and people with disabilities that have experienced self-neglect or potentially will experience self-neglect. Much like what Stephanie stated, Oregon is also a state and county administered program. Roughly 30% of the state of Oregon allegations of abuse and or neglect are self-neglect. So in 2021, that number was actually 27.9%. So 6,300 allegations, just to give you an idea. And as all of you know, there are no two self-neglect cases that are exactly the same. So next slide, please. So something that's a little bit different. The state of Oregon, we believe in the concept of active aging. This encourages the participation of older adults in society, emphasizes the competence and knowledge that they've gained throughout their lives, and really moves away from that loss and decline focus on aging. So on the screen now is the definition of self-neglect for the state of Oregon. Looks very similar to others, maybe a little different in the wording, but the clarifier on the bottom of the page, an informed choice by an adult in relation to how they live, is not considered self-neglect, but self-determination. That really aligns with the hallmark of Oregon's APS program. We are engaging individuals who have experienced self-neglect, and we're balancing that dignity of risk and right to self-determination with safety. Oregon was awarded one of the ARPA and COVID grants. Those are two separate grants. And to embrace the Oregon values and grant parameters, I want to just share briefly with you 3 of our innovative and exciting strategies that are being implemented within the state of Oregon now. They aren't complete, but we are working towards that. So, number 1, to embrace these concepts, the state of Oregon APS program has created a retrospective blueprint, or in-depth review addressing the original statutory framework of abuse and neglect that impacts the inclusive support system we hope to build. By reflecting on historical laws, past practice, and impact on the people that we serve or potentially underserve today, we will learn how to best serve the Oregonians tomorrow. We have performed a comprehensive analysis of the APS program itself in Oregon and created this retrospective blueprint, utilizing the grant funds. Oh, we aren't quite there yet. Sorry, I'm still just talking on this first one. Thank you. So utilizing these funds, we have looked at statutes and policies as they relate to abuse, abuse types, and abuse reporting and investigation. That's the first piece. And we're now at the second review of this information by inclusive statewide stakeholders to gain feedback, to perform a gap analysis. We want to identify areas in need of updating. And then the next step is to develop a proposal for a new statutory framework to offer equitable, non-paternalistic protective services and investigations for adults who are unable to self-advocate or otherwise protect themselves from abuse. At that point, we will be proposing legislative concepts to close any of these identified statutory gaps and update statutory language to better reflect the current understandings of vulnerability with the population we serve. At that point, there will be another gap analysis, and that will be with internal and external stakeholders. We want their feedback of the current program and the needs. So this is an overview of this 3 to 5 year roadmap for overall improvement and enhancement of the Oregon APS program and also the Oregon self-neglect cases. Next slide, please. Thank you. So the program was awarded a COVID grant. And so from the U.S. Health and Human Services Department, ACL Administration for Community Living. So along with this comprehensive analysis that I just mentioned, we are, excuse me, we are hoping to utilize the grant funds to transform the pandemic experience into an opportunity to enhance and improve APS services. So what's listed on the screen here is how we hope to do that. So the first one is to transform, like I said, the pandemic experience. The next one is designing policy and assessment strategies to support Oregonians. So the adults that are involved in APS risk management and self-neglect cases need assistance with decision making when no other support structure exists. The person may experience harm without assistance, and there's a need for a less restrictive alternative to the guardianship or the conservatorship. COVID-19, this whole era, has complicated the issue considerably with the limited face-to-face contact. So we need to come up with assessment strategies. This is going to be included in the work beyond our statutes and policies and beyond assessing just decisional capacity. So also, this ACL grant has allowed us to contract with a subject matter expert. Dr. Stacy Wood is joining our team, PhD, ABPP, which means the American Board of Professional Psychology. And her role is to develop an approach and training education plan for APS workers themselves, serving adults with decisional capacity deficits. This plan will advise APS specialists on how to approach capacity, safety, risk assessments in potential self-neglect situations when the traditional APS approaches may not be possible. and traditional by the extensive, repeated in-home visits, face-to-face visits, when that's not a possibility. We need some guidance as to how we can move forward. So to do this, she's going to help us develop, and like I said, all of these have begun. So she is beginning with us to develop a screening risk assessment tool. So here in Oregon, we don't rely on primarily the slums and the MOCA and great screening tools, but we need something that actually fits the APS worker. And this is going to be considered as part of the resource development package. We need a tool just for us. Also, Dr. Wood's expertise is going to complement the redesign of policy and practice, not only in the whole area of assessing self-neglect, but also when working in the distanced environment, as we have experienced with COVID. Additionally, Dr. Wood will also be developing tools for weighing the risk when deciding whether or how to visit. Is this going to be face-to-face? Is this going to be remotely? It's going to be on a case-by-case basis, as it always is, but we need a tool so we can document the risks and how we went down through them to decide what would be best. And best practice means safety for the worker, safety for that person that we are serving or that we are trying to support. Next slide, please. So the third piece. So we have the policy and procedure, the statute overview. We're looking at the whole program. The second step, using our subject matter experts, developing these assessment strategies, giving the APS workers some tools in their tool belt. This third one was actually in place before the pandemic, and I'm one of these. So I am a complex case investigator, as Krista said earlier. I've been investigating for roughly 15 years. It's been with different programs, and so my role is to actually connect, to make those connections. And I'm not the only complex case investigator, but I handle the self-neglect cases or the cases that might be leaning towards a court proceeding, those guardianships, conservatorships. But we are the hub. We connect this very large state, very large counties. One of them is 10,000 square miles and has 7,000 people. So we've got some distance to cover. When you think of Oregon, you think of the lush green like Multnomah Falls in the picture. We also have desert. We also have other areas and a large mountain range in the middle. So there are some barriers there. Like I said, the state of Oregon has been utilizing these complex case investigators, and we not only link the state and become that hub, but we do things like ensure the warm handoffs are complete with mental health, behavioral health. We support the chronic self-neglect cases. We help the workers to map them out and see what resources are available. These positions began out of necessity to connect the diverse state, reinforcing the unified effort and consistency statewide. While most think of Portland or Multnomah, there's other places. And we also have extensive resources on the west side of Oregon that can be used on the east side. So we are that connection point. Examples of how this is done. So there are the audits of the risk management cases. And so those are cases, the self-neglect cases that I can go in and look at that they didn't quite meet for an investigation, but there was still a risk that needed that short-term intervention. Also, we attend district office meetings. So we travel to these offices, or via Zoom. It's wonderful to have this technology. We also attend the multidisciplinary team meetings, the high-risk team meetings. We monitor cases through CAM, which I know some of the states are very aware of, and Oregon is so thrilled to have. It's our centralized abuse management system. And so all of our information is captured in one spot, and we can access it for resources and for other support to the worker. We also attend NAPSA events, all of the wonderful trainings that you have to offer, and the TARC programs. I am also an active member of WINGS, Working Interdisciplinary Network of Guardian Stakeholders. Is quite a mouthful, hence WINGS. And with that, I'm able to take information from WINGS. And ODHS, Oregon Department of Human Services, and WINGS came together and developed some pamphlets, some easy to read and outlined court proceedings and legal proceedings in Oregon. As an APS worker, we cannot give legal advice, but there are other avenues that we can gain that from. So other publications and brochures. And I noticed that there were some attendees that have a legal background. The practical tool is also a great tool to use. The first thing, it's an acronym. So the first thing is presume you don't need a guardianship and work your way backwards. Go for that least restrictive intervention. So these are some of the things that we are able to connect the state through. Also, I am a contract administrator because we do have some attorneys in the state of Oregon that are willing to work with our vulnerable population and provide legal advice at a very discounted rate. They are amazing people. And so we are able to contract with them, which is so wonderful. We also have an Oregon Public Guardian's office if the need arises. So we do have some resources out there, and we also have some county resources as well. Next slide, please. So I know mine was very, very brief, but I did want those 3 points to be emphasized for you, that Oregon is making some great strides. And that's why we've all come together today, is to learn from each other what these innovative responses are going to be, because self-neglect is difficult. And we are all ready to listen and learn from our counterparts across the US, and let's develop some strategies for addressing self-neglect. Thank you for your time, your dedication to the vulnerable population that you serve. That's all I have. Thank you.
Thanks, Traci. That was great. All right, Joyce.
Hello, my name is Joyce Reed. I am the Director of Field Operations for the Tennessee Adult Protective Services Program. Next slide, please. So let me tell you a little bit about APS in Tennessee. We operate at the state level. We have a state office. We have a program director who I report to, and then we have 2 other directors, one over our centralized intake unit, and then another that has an extremely long title, and I should have written it down, and I can't remember it at the moment. It's like 5 words long, and I always forget it. But she is the queen of collaboration. She really helps us network with a lot of different departments and agencies. But that's her big thing, is collaboration, and we're so blessed to have her. But I am responsible, as the field director, I'm responsible for all the investigative staff. I directly supervise 4 regional supervisors. Our state is broken up into 4 regions, and so we have a regional supervisor over each region. They each supervise 4 team coordinators, which supervise our units, are comprised of at least 4 to 6 investigators per unit. We have 89 total investigative staff statewide. That does include our team coordinators and our regional supervisors. In Tennessee, our statute mandates us to investigate abuse, neglect, and exploitation, But in Tennessee, we also investigate self-neglect because it is a very serious issue in our state. And historically, we have always investigated self-neglect. Next slide, please. So we also received the ARPA funding. And so what we did is we developed the Crest program. And Crest stands for Coordinated Response, or I'm sorry, Collaborative Response to End Self-Neglect in Tennessee. We created it to provide short-term case management services, as well as to pay for emergency needs of self-neglecting APS clients who are not the victim of a crime. It's funded using our ARPA funding, and the program is currently funded for 3 years, as this is only one-time funding. Also, the funding must be used for APS clients only because it is the ARPA funding. Therefore, all referrals to Crest can only come from APS. We are currently contracting with 7 of our 9 area agencies on aging and disability, as well as a few human resource agencies across Tennessee. Our program went live on May 1st of 2022. Next slide, please. The overall design of the Crest program was inspired by CREVA, which is the Collaborative Response to Elder and Vulnerable Adult Abuse. The design of the CREVA program really kind of laid the foundation for Crest. And of course, if you don't know what CREVA is, that's a program that assists vulnerable adults who have been the victim of a crime. When we were developing the program, the very first thing we did was establish a work group. And that work group was comprised of APS staff of all levels. So we had investigators, team coordinators. I believe there was at least one regional supervisor, possibly a couple. And then some state office folks were mixed in there. Intake folks were part of that. We also included our SSBG staff, which is that is our I'm sorry, my brain just went blank. Sorry, someone's mowing and all I can hear is the mower in the background. But we also included SSBG staff and AAAD staff, and that work group came together and developed all the policies, all the procedures, and all the documentation, all the different forms that are going to be used as part of this program. So it was really helpful because we were able to take some of the CREVA forms, adapt them to this specific program, and we actually improved upon them and made them a little more user-friendly and streamlined it a little bit more than what it is with CREVA, so much so that we're looking at hopefully being able to make some changes to that program to streamline it a little further based on the changes we did with the Crest model. So we also developed the monthly reports that the providers will be sending in to track their spending and who they're serving and all that stuff. Our work group met multiple times prior to implementation, especially when we were trying to map out those policies and the forms. We did a lot of stuff by email also, but it really helped to have the whole group come together and really brainstorm and look at the different policies, and especially when we're working on the expectations, looking at time frames, how fast can something be done? Were there any hurdles or roadblocks that may prevent us from being able to execute things in a timely manner? Really just trying to anticipate issues we may run into so that we could kind of hammer those out in the policies and procedures so we would have a guide if those things occurred. Next slide, please. So the Crest program specifically features 2 primary components. You have the specific of financial assistance, and then we have the short-term case management piece. The specific assistance, that can be for emergency food, pest control, one-time rental assistance, clothing, home goods, such as possibly, small appliances like a microwave so that they can cook their own meals, a vacuum cleaner, so, things like that. And then other items also based on the needs of the client. And then we also have the short-term case management piece. And the way we kind of envision this piece would be, if you have a client who needs to get a state ID in order to get a service, that's what the Crest advocate would be able to do. Would be able to take them to go obtain that ID so that they could use that ID to obtain other services. Or if they need assistance filling out a rental application, or maybe getting to a medical appointment so that the doctor can see them and then order a medical device that they need, things like that. These would be activities that APS, frankly, just would not have the time to do based on our caseload size. And currently, we have that option with CREVA, but of course, that typically does not apply to our self-neglect clients because the vast majority of them are not experiencing another type of abuse. They certainly can, but it always seems to be that those clients who really need that assistance tend to only be our self-neglect clients. We always wish, oh, we wish CREVA could help this person. Well, that's what Crest was invented for. It's this program, like I said, it launched in May. And I think probably everybody has probably been experiencing kind of a manpower shortage. I know we certainly are at APS in Tennessee. Our partners are experiencing the same issues. So we're still kind of getting some of this program off the ground. We are getting, staff in place. The providers are getting staff in place so that we can start to really be more effective. We have had a few successes, especially with being able to access things like pest control to prevent eviction, or we've had a couple of situations where a self-neglect client maybe got evicted before we got involved, and so they were basically homeless. So Crest was able to step in and assist that person, and we were able to get them some rental assistance up front so they can make their deposits and things like that, assist them with some furnishings, all those kinds of things, just to get them stable and in a healthy environment. So we're really hoping, as all the staff get hired and everyone's trained and everyone's on board, we have really high hopes for this program. So hopefully in a year's time, we'll be able to report back with some really big successes. Next slide. Oh, okay. That's the end of my presentation.
Great. Thank you. Thank you, Joyce. Thank you all three, Stephanie and Traci and Joyce. That's great. I think what I'm hearing is everybody come back. We're going to be back here in a year, 2023. We're going to hear all about these exciting new programs. I think it's going to be really interesting to see how they roll out and what the outcomes are. That said, there's been some questions coming in, surprise, surprise. And so we will go ahead and, so panelists, if you want to go ahead and turn your cameras back on, and we'll take some questions with our remaining time. Please feel free to go ahead and send those questions in. So the first one is going to go out to, this is probably more specifically for Stephanie. A question: if you were not within the APS system, how could you potentially, as a stakeholder, a collaborating organization, how could you advocate for legislation or statute change, like what you're piloting in Colorado?
Well, that's sure. I think, I'm not by any means a policy expert that on matters of policy in other states, and much less even in our own. But there are bills that come from an average citizen. It doesn't always have to come from some department or some official regulated program. I think in general, when we talked about counties kind of pulling together and they got some sponsorship and they moved forward and they were able to get a bill introduced. There certainly is some leverage there with professional associations and relationships and all of that, and some weight behind the name of an agency. But I think, there are lots of bills that sort of the initiator has been a citizen who was super concerned with something, and they began to, write their senators and write their representatives and find somebody who was interested in sponsoring it. And so as far as I know, my assumption is that in general, that this concept should apply in other states. But I don't know that I have a lot of tips and tricks on exactly how.
Yeah, no, that's perfect. I think that's, I think you touched on the essence of that question. So thank you. So this is for Traci. So Traci, Since you talked about guardianship, and then this can go out to the other panelists as well, love to hear, are there any services that you have found are particularly useful for guardianship diversion? Or are there any gaps in services that you've noticed contribute to potentially unnecessary guardianships and conservatorships? So that's a two-pronged kind of big question.
And we're definitely getting some solid questions. Good deal. So I guess, well, let me start with, yes, there are some gaps. I do want to start there. And each case, like I said, is very different. So there isn't a pat answer for that. You know, we don't have that go-to, I guess, here in Oregon. So each case we're going to look at and break down what the risks are. And then we're going to look at what are the least restrictive options that are available to that person and how can we implement them. And so diversion for guardianship, no, not complete diversion, but we are definitely going to look at least restrictive first and make sure that all other options have been utilized.
Great. Any Stephanie or Joyce, do you want to anything to add? Nope. All righty. Okay, well, we do have another question. So Joyce, does there have to be a finding by the APS professional of self-neglect before the Crest emergency funding or short-term case management can be utilized?
Yes, our policy requires that service provision can only be an option if the allegation is substantiated. So yes, we would have to determine that the person was in fact self-neglecting.
Great. Okay, thank you. So this is probably Stephanie. How do you expect the unannounced visit to client will help in the investigation case of self-neglect? Okay, so it's actually the opposite, right? It's the you are going for the AR, you're going to have an announced visit or a scheduled visit. Is that correct?
Correct. The current requirement for all cases is the initial visit is unannounced and in private. And so what AR will do for self-neglect and for any other types of allegations that are tracked to that will allow, it doesn't mandate that they be scheduled, but it allows the county to schedule them rather than requiring them to do this in an unannounced fashion. So by moving it that way, obviously we do hope that it sort of reduces this unanticipated, discomfort. We know that that's part of the process, and there's a value for certain types of investigations, but it doesn't engender a lot of positive feelings when you show up at someone's door as APS. I think we all know that. So yeah, that's the hope.
Right. And then Joyce, are you so the program that you talked about, the CREVA program, is that VOCA money? There's a question around or do you have VOCA money as well if the CREVA program isn't VOCA?
I believe that is VOCA money.
Okay.
The Tennessee Commission on Aging and Disability actually holds that grant, and then they contract with the AAADs to execute that program. So, but I believe that is where the VOCA funds are going, is for that program.
Great, thank you. Let's see. So this may have been touched on, but what is the policy for naming the adult as the alleged perpetrator for self-neglect? Now, I believe, Stephanie, you kind of touched upon that there's not going to be a finding with the AR. Traci or Joyce, do you have a named perpetrator in self-neglect cases?
We do not. In Tennessee, in our report where there would be an alleged perpetrator named, it just is blank. We don't indicate the adult as a quote unquote perpetrator. It's just them as the victim, as the alleged victim.
And yes, that's the same in Oregon too. We don't identify them as the perpetrator. No, they are the victim.
Great. Okay, thank you. So this question, I think, Stephanie, this is for you. So how do you address situations of self-neglect when a legal intervention, such as an APS order, might be necessary? So for example, a self-neglecting adult temporarily lacks the capacity to consent to APS services because they have an acute illness or something like that.
Yeah, I mean, I think that the Cliff's notes of whatever their needs are, we work with them to try to meet those. So if the need is that there's a concern with someone's ability, you know, to make decisions, or they need guardianship or conservatorship, then caseworkers try to figure that out for them. And if we do refer to sort of those types of needs as involuntary case planning, right? Like we really highly prioritize self-determination and consent, but we recognize that there are times that clients may not have the ability to consent to services. And so we look at, you know, we work within the confines of the court system here to identify, you know, potential nominees, all that kind of good stuff. So I'm not sure if I might be maybe missing the intent of the question, and I hope that if whoever asked it has a little bit more they want to dig into, feel free to email me. But
okay, no, I think you got to the essence of the question. So thank you. All right, looks like we have time for one more. And yeah, so actually I'm just going to put this out to all of you and see. So this person works for Illinois APS, and they've been working on self-neglect cases for 4 years. What are you all looking at for hoarding, resources, room mapping, counseling, cleaning, etc.? So it's a big question. So Traci, is this in your wheelhouse a little bit?
It is, yes, it is kind of. So what we look at for hoarding, again, is individual, but we are going to incorporate those mental health services if we can, you know, if this person meets for their program. And you mentioned the room mapping and the cleanup and all of that sort of thing. We're going to look at a home if they can meet their needs within it, if they are able to provide for their basic needs within the structure that they've created, and we don't have those blatant physical safety risks. We're going to work around what their lifestyle and their life choices are if they can demonstrate that understanding of what the outcome of their choices is going to be. So we definitely are going to work very cooperatively with them, but we do want to bring in those external resources like mental health or look at other options that are available.
Great. Any other additions? Anything to add?
I know here in Tennessee, one of the things we have tried to do with some of our hoarding cases is do what we call a team clean. When our homemaker programs were fully staffed, sometimes what they would do is pull in homemakers from surrounding areas and come together and have some funds to rent a dumpster or get volunteers from a community group. Usually churches were very helpful, and have, you know, literally a bunch of folks with pickup trucks, and the homemakers would go in and they would clean, you know, they would gather up all the trash and the debris and throw it in the back of the pickup trucks, and the volunteers would drive it off. That has been, since we've had such a hardship with staffing the homemaker programs, that's really not been an option lately. And with COVID, that's just gotten that much worse. We have looked into hiring professional companies to do that, and the cost is just astronomical. We've actually kind of internally said, you know, there's got to be a grant for this somewhere. Maybe we can find a grant for just cleanup, you know, something that we can do, because our funds for our Crest program are kind of limited. So we, you know, it would wipe out one entire part of the budget if we tried to do just a couple of those. So that's what we try to do. We try to find unique ways to meet the need. But I will say one of the largest hurdles that we have, especially if it's a true hoarding situation, is just the client just will not let go of the items. So it's minimal impact that we can have because they just won't let so many things leave the home. But we try to get with different volunteer groups and things like that that would be willing to come out and help. But ever since COVID, that's gotten very difficult.
Right. Hence the coupling of short-term case management. Yeah, no, definitely. It's very complex. So yeah, we could have a whole nother webinar on that. And believe me, we almost went there, but that's a whole nother webinar. So well, thank you. I'm going to go ahead and I think we have made it through almost every single question. So thank you, Traci, Stephanie, and Joyce for sharing about your projects. Again, everybody join us back. We'll have a in a year. I want to hear. We'll have everybody back. So thank you for your time and your wisdom. I want to thank Andy Capehart on the back end doing slides. Thank you all for joining us today, and the recording will be out as soon as we can work on the transcript, and we hope to see you here next time, August 2nd, for strategies for APS cases involving homelessness and housing insecurity. Registration is open for that. If you have not seen it, please email us. We'll send out a reminder soon, and have a great rest of your week, and take care. Thanks, everybody.
Thank you.
Bye-bye.